So this past month of March has been Endometriosis Awareness Month, a time when people come together from all across the world to help raise awareness for endometriosis, a health condition that affects 1 in 10 women in Australia. So I'm here with my lovely friend Camille, and she's going to tell us a little bit about her experience with endo. So Camille, why don't we start by you giving us a little bit of information about when you were diagnosed, and how you went through that process and how it was for you.
Sure. Okay, so I was 16 when endometriosis was brought to my attention. I'd only had my period for a couple of years at that point, and it had been horrible. I was experiencing a lot of pain, a lot of physical pain. I was having a lot of bad cramping, a lot of nausea. I used to get really bad migraines. My period would last for over a week. Luckily for me, my mum has endometriosis, so she was able to recognise a lot of my symptoms and took me to see a specialist pretty early on. And I say that because I think the normal diagnosis is about 8 to 10 years.
Yeah.
So at the age of 16, I was put on the pill to try and help manage a lot of my pain. That didn't really do too much. So by the time I was 19, I went back to the same specialist I had been seeing, and she suggested that I have the surgery, the laparoscopy. And unfortunately, you can't be properly diagnosed without that. So yeah, that was a pretty big thing to do at 19. Yeah.
And through that process of having the surgery,
mm-hmm.
How did you go? Was it an easy, not necessarily easy, but were you supported? Were you told what was going on and what endo was, and why you needed to have the surgery?
I definitely was told, I think to the best of the doctor's ability, what it was.
Mm-hmm.
There wasn't a whole lot of information though, and not enough for me to grasp it. And to really have a true understanding of what was going on in my body. I basically just thought I had really, really painful periods and that the surgery would fix that.
Okay.
So it would have been great if I were able to have more resources, more information, and a bit more support, I think, from either that particular doctor themselves or their staff, or yeah.
And moving forward then, these days, and I guess leading up to now, how has the condition affected your day-to-day living?
Yeah, it's been really challenging. I experience a lot of pain regardless of whether I'm menstruating or not, which is quite hard because sometimes it can completely take me by surprise. Whether I'm, at work or cooking or doing something, sometimes I'll just double over in agony from having a random cramp or something like that. I experience a lot of fatigue, so sometimes the thought of getting out of bed in the morning is really difficult. It's hard because it affects things like my work, and it affected my studies. When I was at uni, I ended up having to go on a disability access plan just so that I didn't have to provide a doctor's certificate every time I needed to take some time off. So yeah, it can be quite debilitating.
And then I guess there is the physical side that you're experiencing, as well as maybe the emotional or the psychological impacts of that.
Yeah, absolutely. It's definitely affected relationships in my life, like whether that's been with friends and family or intimate relationships as well, just because there have been times where, because of the pain and the lack of understanding and the hormone fluctuations, I've just felt completely beside myself. So there's been a lot of unexplained tears, a lot of emotional breakdowns, and just feeling completely overwhelmed.
Okay, so as this past month has been Endo Awareness Month, have you noticed a lot of the infiltration into your social media, and how have you felt about the whole thing?
So I'm really, really pleased that it is becoming a more public conversation. I guess, like, there's been a lot of coverage in media. I make a big effort to follow people on my social media who are supportive of endometriosis. So organisations like Endometriosis Australia is one major one. So I think it's really positive that people are talking about it and bringing more awareness. Because a lot of the time I'll still talk to people now and say, oh yeah, I've got endometriosis, and they'll say, what's that? Which is a bit frustrating for me, because it affects the same amount of women as people who are suffering with asthma and diabetes. So it's pretty common. The problem that I have with it though is that there hasn't been much coverage in the media of complementary treatments. I think it's been quite directed at your conventional medicine, which is fine as well, but I think that's not the answer for everybody. So I really wish that the media would give more resources on other options.
And that's a nice segue, I guess, then into what has your experience been with the medical system and finding treatment for you? So obviously it's a long-term thing.
Yes.
Endo's always with you, and it will be with you for a long time. So you've obviously been through the conventional medical system.
Yes.
And it sounds like complementary medicine is something that has been a part of your journey.
Absolutely. So I think, like I said, pretty big thing to do at 19, going into surgery, and not having much awareness of what was going on, but also being told at that age by, GPs, gynecologists, all sorts of different people in conventional medicine, saying things like, the things that are going to fix this problem for you are either having multiple surgeries, getting pregnant, or having a hysterectomy, which is pretty big things to consider at that age, or just at any age really. Like, it's a lot. And then to be told that being on the pill was my only option in terms of treatment, it was really frustrating, and I was really terrified because so many people had said this to me. I was really, really scared to then seek other options out, even though I felt like that wasn't working for me. So that was really, really scary and really challenging. And then it wasn't until I was much older that I started doing my own research and reading different blogs and seeking people out in social media that were supportive of other types of treatment. And that's when I sought out seeing a naturopath, and that's probably the best thing I've ever done for myself, because it's been simple things like diet change that have made a huge amount of difference to my pain and just the way I feel mentally as well. So I feel like that is really important to know that there are other options out there.
Absolutely.
But also, in saying that, what works for me might not work for everyone, because it affects everyone so differently.
Okay. Well, I think we'll leave it there.
Okay.
Thanks so much for sharing and for being very honest. Great.
Thanks for having me.
No problem.